Full viscera and irregular organs. The gallbladder. There are 6 full viscera: the gallbladder, the stomach, the small intestine, the large intestine, the urinary bladder, and the sanjiao. Their main physiological functions are to receive and decompose food and drink, and to pass and discharge waste. Their main functional characteristics are to digest and transform matter, but not to store it, and to function well when unobstructed. When full organs are disordered, the main method to restore their functions is by restoring their patency. The gallbladder. The gallbladder is a sac-shaped organ that is attached to the underside of the liver. It has 2 principal physiological functions. First is storing and excreting bile and aiding digestion. The liver produces and secretes bile. The bile then flows into the gallbladder where it is stored. Bile has a yellow-green color and is bitter in taste. It is important in promoting digestion. For this reason, bile is also called the essential juice, and the gallbladder, the house of the essential juice. The storage and excretion of bile are regulated by the liver function of conducting and facilitating. If this liver function is normal, the gallbladder excretes bile properly. The bile then flows into the intestinal tract, where it helps the spleen and stomach to carry out normal digestion. Diseases in the liver will affect the production and excretion of bile and impair digestion. Such symptoms as epigastric distension and pain, anorexia, aversion to greasy foods, abdominal distension, and mucoid diarrhea may appear. Upward flow of bile can lead to a bitter taste in the mouth, nausea, and vomiting. If bile overflows into the skin, there may be jaundice, with yellowing of the sclera and dark yellow urine. If dampness and heat accumulate in the liver and gallbladder and cause blockage, the liver loses its function of conducting and facilitating, and the gallbladder its ability to excrete bile. This may lead to the formation of bile stones. In this illustration, we see the gallbladder. The liver, where the gallbladder is found underneath, stores the bile. It excretes bile and aids digestion. When there is failure in the gallbladder of conducting and dispersing function of liver and gallbladder, there will be disharmony between the liver and gallbladder that affects courage and spirit of initiative. There will also be bitter taste, poor appetite, there may be nausea, there may be jaundice, and distending pain in the right subcostal region, and there may also be loose stools. Second, the gallbladder has the ability to decide. It is courage. The plain question states, the gallbladder is the upright official in charge of decision making. This explains the relationship between the gallbladder and the person's ability to decide. Courage is also closely linked to the gallbladder. Deficiency of gallbladder qi may appear as fearfulness, insomnia, and dream-disturbed sleep. In this function, the gallbladder is closely linked to the liver. These 2 organs cooperate to regulate the emotions. The normal functioning of all mental activities, such as careful thinking, judgment, determination, and decision-making, requires cooperation between the liver and the gallbladder. Thus, in clinical practice, treatment of the liver and the gallbladder is the approach to many disorders involving the emotions. Thank you for listening.